to be here and share with you guys today.
Thank you for being here. Yeah, earlier today, I was sharing with everybody, you're one of those people I could literally talk to for an entire day and not run out of things to talk about. So I'm really grateful to have you here. I've shared with everybody a bit about your background, functional medicine and nutrition, especially expertise. Everybody's really curious, especially how those things and your practice intersect with microdosing practice. So just to share with everybody a little bit about, I met Julie in the medicine space. She too also works supporting people in the functional medicine with nutrition, but also microdosing support as well, combining all of those practices. And she recently moved from Southern California to Texas very recently. So she works virtually with people all over the country too. So Joel, I wanted to start out with asking you to define for people what functional medicine is. It's a term that most of us have heard of, but how does it differentiate itself from traditional medicine?
Yeah, it's a question that I get all the time. People say, what is functional medicine? And basically, it is a section of medicine that really gets at the root cause of illness or the lack of wellness. And I really love it. I think there's so many amazing tools that are available in functional medicine. However, as I have become much more comfortable and adept in terms of utilizing a wide variety of tools in my elective toolbox, it can also be reductionistic, and it's also gotten a bad rap in that many providers just really go and order every single test under the sun that is not covered by insurance, as well as maybe really recommending all kinds of different supplements. And some people are adept and willing to take a number of things, and other people aren't. And we don't always need to be on 1,000 different supplements. So I use the best of both worlds. I was conventionally trained as a registered dietitian back in the 70s. And I often joke and say, I did not want to be the dietitian with the hairnet in the basement of the hospital. So I did a quick exit to look at more integrative, holistic opportunities. And there was not much available back in the 70s. So I've had a really convoluted, but amazing and rich journey, and did my grad work in counseling and psych, which I use every day of my life, and then went on to do, again, functional medicine training, genomics, Reiki, yoga, and mind-body medicine. I was lucky to be right next door to Herb Benson at the Deaconess Hospital in Boston, and was able to do his program, his certification program back in the 80s. So it was great.
Beautiful. Yeah. Thank you. One of the things that we're fascinated by, when we read the research that's been done, especially regarding microdosing, which is so limited, everything is so focused on the brain specifically, when in reality, we have just as many serotonin receptors in our gut as in our brain. And so you and I have talked often how, our diet and our nutrition is kind of it deserves a lot more attention in the role of healing than it has gotten to date. So when we talk about the gut and gut health, can you tell us what comprises the gut? Where is it in our body? As a whole, what organs? And also, why is the gut health so fundamental to our overall systemic health?
Yeah. So there's the gut-brain connection, which we hear about. And we used to think that the brain was really in charge of all of the different functions, but without that communication between the gut and the brain, we're not going to be a functioning human being. So I'm going to back off and call it the digestive system. So the digestive system begins in the mouth and it ends in the anus, and all that tubing in between, and the stomach and the gallbladder and the liver and the pancreas, those are all part of the digestive system. And so if something goes awry anywhere along that tubing and those various organ systems from the mouth to the anus, we can have a problem. And so part of it is really looking at what's your oral health look like. Are you having a lot of reflux and digestion? And what's interesting is so many people are on proton pump inhibitors or hey, take a Pepsid and then you can eat whatever you want, which is not a great thing to do. Or once on a proton pump inhibitor, always on a proton pump inhibitor, that inhibits your stomach acid. And a lot of times people that have indigestion actually have what we call hypoacidity, not hyperacidity. And then we're not absorbing our vitamin D, and we're not absorbing our proteins, and we're not absorbing all of these vitamins and minerals that are important for our brain health. So again, we have to really look at where is the problem along the way, or the multiple problems, identify them, and then do some course correction. One of the things that I always do before I work with someone is I will ask for all of the list of medications and supplements that they're taking. I cross-reference everything to make sure that there's safety, that there's efficacy. And for people that have gut dysfunction, I oftentimes am taking them off stuff, because when you think about it, supplements are concentrates. And if your digestive system can't function normally, then why are you taking concentrates? So I oftentimes back off and then very slowly introduce things to start healing the gut process. So that's kind of a long-winded answer, but hopefully that answered it.
No, that's fantastic. Yeah, I certainly don't think of the gut as the whole system, from start to end. So thank you for that. Also, another really under-researched area is the connection between our gut health and our mental health. And eating for strength and resiliency in our mental health. Can you talk about the connection between the gut health and our emotional health?
Yes. So I would have to say that the conversation that I have every day and multiple times a day is protein. And part of the reason for that is, again, I've been doing this, for almost 45 years as a dietitian, and I've seen all the various fads and focuses that come and go in terms of high protein, low protein, high carb, low carb, high fat, no fat, low fat, whatever. And, many people actually started to consume way too little protein. And when I'm doing assessments with people, I usually find that that's the case, that there's not enough good quality protein, or that they're so focused on plant-based proteins that they're not really getting all of the amino acids that they need to get, as well as iron, B vitamins, and things like that. So protein, believe it or not, breaks down into amino acids that make our neurotransmitters. And our neurotransmitters are basically the brain chemicals that communicate to one another to tell us if we're happy, we're sad, we're in pain, we're tired, whatever we might be feeling. So protein is extremely important for that. Another thing that's really important in terms of brain health is being able to detoxify properly. So I oftentimes joke with everyone and say, you know what, I talk about poops in my office every day, because if we're not pooping every day, then we are recycling toxins. And especially for women, we actually deconjugate, which means we break open estrogens, and then we reabsorb the toxic parts of the estrogen. And that will pollute our brain. The other thing is, if we're not properly breaking down those proteins, because you might be taking Pepsid or Protonics or something of that nature, you can be recycling ammonia. And ammonia in the brain will cause fogginess, forgetfulness, mental health issues. So detox is super important. Green leafy vegetables really, play a huge role. And there's ways to cook those green leafy vegetables. And that basically is, lightly wilt them or saute them, and then have a little bit of an acid and an oil together. When you supply both the acid, like an apple cider vinegar or a tomato sauce or whatever, and then an olive oil or avocado oil, what you're doing is you're allowing the nutrients to be taken out of those green leafy vegetables, because green leafy vegetables are also high in oxalate, and many people have heard of the word, oxalate, and that can be very inflammatory to the body, the bones, and things of that nature. Yeah.
Fascinating. Thank you. Shifting gears over toward another one of your passions I'm aware of is women's health, and health through, rites of passage, through menopause, hormonal fluctuations. Again, this is another really under-researched area when it comes to plant medicines. Can you speak a bit to this time, and as much as you can, about, the research is limited, but our experience with medicines and menopause and women's hormones?
Yeah. I was actually just pulling together another talk that I'll be doing later in the month, and pulling together, PubMed studies, frontiers in medicine, and places that you're actually going to get some pretty good research. again, there's limited research, but it is getting out there along with anecdotal evidence. But what's wonderful about the serotonergic aspects of plant medicine, like microdosing and psilocybin, is that you're not only supporting feelings of happiness and whatnot, but you're actually supporting feelings of joy, passion, and you may be experiencing more pain and also more emotional pain. So we have to look at, I do the comparing and the contrasting of SSRIs and plant medicines because, SSRIs are the most commonly used medications for women as they're going through perimenopause and even sometimes postmenopausal. And part of the reason for that is that as estrogen declines, we will be feeling some of those emotional well-being lack changes that can also occur. So estrogen decline, plays a role in not only our mental health, but our cognitive health. Can we focus? Can we retrieve? Can we learn? How is our memory? All of those types of things. And estrogen also plays a role in pain management, so that, we can blunt pain to a degree when we have good levels of healthy estrogens. And as that declines, we may feel more pain. Estrogen plays a role in bone health, so it's brain health, bone health, cardiovascular health, immune health. Believe it or not, I've done a lot of research on allergies, the immune system, estrogen, and how those all interact with one another. And our immune system is impacted as well when there's an estrogen decline. So those are definitely some things that kind of play a role. And so I am always looking at, what are the symptoms of estrogen lack? What are the symptoms potentially of progesterone lack, which would be sleeplessness and things of that nature? And then what are sort of the pain points that somebody's experiencing? And again, that doesn't mean just physical pain, but emotional pain. And then how can we support that? And psilocybin does a great job of, again, allowing us to feel more of that joy, more of that passion. It also doesn't blunt libido the way that SSRIs do. So that's a huge one. And, again, as I've done more explanation on, sexual activity and libido, that helps our hearts. That also helps to support increasing our white blood cells and our natural killer cells to support our immune systems. And it also helps with pain reduction. So I think there's some great potential in terms of microdosing.
Fantastic. It's super common, especially at the beginning of practice. In almost every group we've had, we have one person that really gets hit with fatigue, extreme fatigue right in the beginning. And then it's really common too, as you evolve and deepen your healing over months and years, to go through periods of time where you're really tired and you needing to nap and sleep. So can you talk a little bit about the role of sleep? What is going on when we sleep? And what is, how do we adjust our sleep and allow for our deep sleep when we need it, when we're going through these periods of healing?
Yeah, absolutely. So we all need at least that 8 hours or so of sleep, of good quality sleep. And for people that are taking any psychiatric medications, probably 9 to 10 hours. So I have a fair heavy load of folks that are on antidepressant as well as antipsychotic medications. I have some bipolar patients. And so I'm always talking with them, you're not a wimp for needing 9 to 10 hours of sleep. You need to do that in order to recycle and have enough serotonin in your brain. So not to feel badly about that. Getting rid of, the blue lights, the computers and the phones and the screens and all that kind of stuff, and getting that, out of your bedroom at nighttime is really important. The research shows about a 2-hour period between, shutting off your devices and going to sleep will help in terms of having better sleep. And the other thing is that our brains actually go through detoxification during sleep, and it's called the glymphatic system. So many of you have probably heard of the lymphatic system, and lymph actually helps to squeeze and push toxins out of the body. But the glymphatic system is in the brain, and it helps the brain to detoxify so that we're also not building up, amyloid and things of that nature, which can be linked to Alzheimer's and dementia, which we know are really, on the rise in this country along with diabetes. It's called type 3 diabetes, and a huge surge in that. So again, sleep hygiene, really, really important. I oftentimes tell people, take a nice hot Epsom salts bath at night, throw in a few essential oils. Some of my favorite essential oils are cypress, which actually helps with lymph drainage, and wintergreen, which has not been easy to get recently, but wintergreen actually has salicylic acid, which is found in aspirin. So it's part of the pain reduction, and the smell of those two together is really quite amazing. So I frequently will use that with Epsom salts as a way of, again, cleansing, increasing magnesium absorption, which will also help with our sleep.
Awesome. Thank you. Also, another one, as we're turning into summer now, hydration is something that we tend to notice more in the summertime, and less so in the colder winter months. So lots of people, without even knowing it, are really dehydrated. So can you talk a little about the importance of hydration and kind of what are the signs that we can mistake for other things that are actually based on dehydration?
Yeah. So some of the symptoms can be feeling hungry, believe it or not, when actually you're thirsty. So that's one thing. Increasing fatigue, fogginess, forgetfulness, pains, aches and pains and things like that will go along with dehydration. And it's not just water, but if we're out in the hot sun for a period of time, or we're doing really, more intense activity, then we need to replace some of our electrolytes. And I have actually a favorite beverage called Electrolyte Synergy that I use. Anyone's, welcome to reach out to me and I can tell you about that. But what I like about Electrolyte Synergy is it has all the electrolytes, and it also has a particular sugar called D-ribose. And D-ribose is the sugar that innervates the cells and helps to hold on to the fluids within the cell. So, we've also heard of people that have overhydrated and have actually either died or have become quite ill from just drinking way too much water by itself. So it's really not only just the water, but it's also all those other components. Now, again, if you're not out in the hot sun and, you're not doing extreme exercise or long bike rides or things like that, water certainly is important. But, certainly think if you are going to be in some kind of extremes to make sure that you're getting those electrolytes as well.
Beautiful. Thank you.
Oh, I get one other thing about that.
Go for it.
As we age, we don't feel as thirsty. So we oftentimes have to drink, even if we're not thinking that we're feeling thirsty. Huge issue in the elderly population. Now, none of you are in the elderly population, but if you have parents that are, that's one of those things too, in terms of really making sure that they're, getting hydrated.
Thank you. That's great. As you alluded to in the beginning of our talk, with functional medicine, it's really easy to go down the rabbit hole of a million different labs and tests and things. So for someone who's new, what are the top 3 things that you recommend that people have checked that you see in your clients that are really, really common that people are out of balance, that if you're just going to do like the top 3, what would those be?
Yeah. So when I meet with somebody, I usually request all of their labs and tests that have been done over the last couple of years. Now with COVID, I usually say at least the last probably 2, maybe even 3, because some people actually haven't been tested during that period of time. I look over a CBC, which is a complete blood count. That'll tell you a little bit about iron stores, white blood cells, things like that. I also rec a CMP. So, and these are things that are what we call standards of care. So usually at your annual physical, your doctor's going to do those anyway. A CMP is called a comprehensive metabolic panel. That will look at all of your major systems. It'll look at your, your cholesterol. It'll look at your liver functions. It'll look at your kidney functions. It'll look at, again, protein and things of that nature. So that's where it'll also look at blood sugar. So that's a really good overall one to look at. With women that are, again, are hitting around perimenopause, menopausal stage, and even women, earlier that have some hormonal challenges, I'm oftentimes looking for a ferritin level. And ferritin is an iron storage lab. It's not, again, a standard of care. Some doctors don't even know what it is, and and I always will put in, dear Dr. So-and-so, if you agree, I'd like to have this drawn. This is my reason why. Because iron storage, when it's low in women, they will be experiencing much more fatigue, depression, pain. So even musculoskeletal pain can go along with a low ferritin level. So that's another one that I really like to look at. For For someone that has inflammation, I might ask for an HSCRP, which is protein. That's kind of a generalized inflammation marker. So that's a good one to take a look at. Again, if I have someone who's really fatigued, tired, kind of, lacking along the outer third. I actually have no eyebrows left. My mother used to, say to me, it's because he used to pluck them as a kid, but it's because I actually have I have a rare thyroid condition. But again, lack of, the eyebrows and hair coming out and things like that, I oftentimes will also request what I call a complete thyroid function panel. And so that's not just looking at a TSH, but it's going to be looking at all of the thyroid functions. And so those are my favorites. Might be a little bit more than 3, but those are my favorite ones.
No, that's super helpful. Thyroid, iron, ferritin, and comprehensive metabolic panel. No, that's super helpful. Perfect. I wanted to move to like your favorites round. So there's so many supplements that, again, you could go down a rabbit hole of all kind of vitamins and supplements and this and that. What are your 3 kind of favorite go-to supplements that are supportive for people?
Yeah. So for a lot of my folks that do have a little smattering of, energy, mood, anxiety, things of that nature, I really like Thorne Basic Nutrients. And again, if anybody wants to reach out to me afterwards, I can get you in touch with the company on that one. And I'm always changing my multivitamin, so I stay on top of who's coming out with the latest and the greatest. What I like about Thorne is that the B vitamins are in their methylated or their most active form, which means that we don't have to go through the process of breaking it down to absorb it. Many people actually lack the enzyme ability to convert non-active forms of B vitamins into active. And so most of your over-the-counter multivitamins use cheap forms, like a Centrum or things like that. They're not going to be in their activated form. The other thing I like about the B vitamins is they're not in such a high amount that it can over push the B vitamins, which can also relate in anxiety. So if somebody gets too much methyl B12 or too much methylfolic acid, they can actually feel anxious too. So they're providing you with enough, but not too much. So I really like that part of it. It has 2,000 IUs of vitamin D3, which I like, and it also has some vitamin K2 in it. It's got some magnesium, zinc, some of those other things that are really important, and especially as we're still kind of managing COVID, making sure that zinc is in your diet and maybe in a multivitamin is a good thing to do as well. So I really like that one. My second one that I really like is Orthomolecular makes a liquid vitamin D3 with K2. And I oftentimes have clients that are taking D3, but they're not taking it with K2. And I've attended enough in-services to really feel confident that you really need to have the 2 of those together. And part of the reason is that D3 doesn't get absorbed to do its jobs, and its jobs are immune health, mood, bone health. All of those things are real. Cardiovascular health, kidney function. All of those are under the auspices of vitamin D3. But if it doesn't have the K2 attached to it, the D3 can't do its job properly, and it can actually cause more problems than not. I also like it in the liquid form because I can titrate doses based on a person's labs. And I usually find that people are not in the ideal or the sweet spot of vitamin D, which should be between 50 and 80. And oftentimes 2,000 IUs might not do it. So therefore the multivitamin might not be enough. And then I can use my dosing accordingly with it. I also work with a lot of allergy and immunology with a doc back in Boston. And so I'm always looking for supplements that don't have a lot of other stuff with it. So this one is just with MCT oil, and that's it. There's no other stuff added to it. So I like that one. And I love the wild caught marine collagen. And what I like about that, I use different forms of collagen with my clients because I think it's really a good idea to get a variety of sources. What I like about the marine cod is that it melts or blends into anything. You could put it in your coffee. You could mix it with pasta sauce and put it over vegetables if you felt like, ugh, I don't really feel like having, meat sauce or turkey sauce or whatever. It actually creates sort of a creamy texture. And I'm always in the kitchen. I'm a foodie. I've written a couple of cookbooks. And so I'm always thinking, how can I use that, that collagen in a way that's really creative? So it can go anywhere from putting in your protein combination for breakfast in the morning with your fruit, all the way to your salsa or your pasta sauce at night, which is kind of cool. So those are my three favorites. And then I base other supplements based on what needs are.
Beautiful. Thank
Yeah.
you. Moving to whole foods, which I know your love. If you follow Julie on Instagram, you'll see a lot of tasty food in your feed. Of all of your favorite foods, what are your three favorite foods that you think everyone should incorporate into their diet? We all get in food ruts and eat the same thing, day in and day out. What are your three favorite foods that you love to see people incorporate?
Yeah. And I know I put it in my post yesterday. I said, this is going to be one food on Casey's, talk tomorrow. Broccoli sprouts. How many of you are familiar with broccoli sprouts? I had somebody yesterday who said, I have no idea what that even is. So
I don't, and I've used plenty of sprouts, but I'm so curious why specifically broccoli. Yeah.
So broccoli sprouts are probably the richest in sulforaphane. And when we talked a little bit about liver detox a little bit earlier, and also estrogen, detoxing the bad estrogens, sulforaphane becomes one of those really key chemicals, and they're in broccoli sprouts. And so I love broccoli sprouts. And it's funny, when I was back in college, I used to grow my own sprouts, and I soaked my own beans, and I made my own yogurt. And now I'm super excited to be working with Matt per Casey. And now I'm going to be growing my own shrooms. So I'm very excited about that as well. But broccoli sprouts are wonderful. Again, rich source of sulforaphane. So that's one that you can put in salads. You could put it in a sandwich if you want. If you follow me on Instagram, I'm always posting about food, companies that I really like that use clean sources, ways to kind of get around the lower carbohydrate, but not no carbohydrate craze that I think, people get a little bit, caught up in. Salmon, wild caught salmon, really, really good source of omega-3s, excellent source of protein, great for brain health. And in fact, I'm trying to remember, years ago, there was the Perricone craze, and he was I think he was a dermatologist anyway, but he got into the whole beauty field, and it was avocados and salmon. So that we can have beautiful skin as well as have great hearts. So anyway, I love my salmon. And I love ginger. I use ginger every day. Ginger is a great anti-inflammatory. It's great for the gut. It's great for the immune system. And I usually get, my own organic tubers, and I cut off about a 1/2-inch cube. And that's a really good amount that you can slice up into anything. So I put that into my protein mix usually in the morning. I will sometimes even oven roast that with vegetables and a little bit of coconut oil, and it's absolutely delicious. So those are three favorites.
Yeah, love it.
Yeah.
Ginger, broccoli sprouts, and salmon.
Yeah.
Got it. Awesome. Lifestyle things. So I'd love to know, as much as we focus on what we're putting into our bodies, what should we take caution to avoid, and or lifestyle things you see that people unintentionally are doing themselves harm, taking in toxins and things to let go of. So kind of habits to stop that you see.
Yeah. I'm actually going to add a fourth one to that one as well. But one of them is alcohol. I joke with my women. I go, women and wine over 40 don't mix. It's really true. I mean, it really impacts our REM sleep. It impacts, when the research was done, dynamic wine, which is not easy to find in the States, and it was 2 ounces of red wine. Now, I have not found a 2-ounce red wine glass in years. My mother had some, many, many years ago. But I find that that's a habit that many women just really are wrestling and bargaining with me all the time. And it's not a judgment issue. It's really around women's health, and alcohol. They're just incongruent in many ways. So that's one that I think is a challenge. Sleep hygiene is a huge one. I think, again, getting to bed by 10, because the body clock starts working between 11 and 3. And that's when all the different systems, the kidney, the livers, the heart, the bones, the brain, they're all on a clock that's going to start its cleansing routine. So if we're going to bed past 10 o'clock, then we're cutting into that time. So that's another huge one. And another one is overexercise. And you know what? I was a personal trainer back in the day, the Jane Fonda days where you go for the burn and, you kill everybody on the mat. And oh my God, what I used to do, jump on the floor, the cement floor. But I oftentimes am seeing people doing overexercise. And so again, I'm bringing people back to, listen, at this stage of the game, less is more. And I'm also finding that many, many women have autoimmune illnesses, which is an inflammatory condition. If you've got an inflammatory condition, high intensity exercise for long periods of time is only going to increase the inflammation, not decrease it. And I see that over and over and over again as I'm coaching my patients. And I find, wow, they'll say to me, oh my God, it really makes a difference, but it was so hard for me to cut back. I was a college athlete and I always did this. And, so that was, that was another thing. So those I think are really, really important ones for sure.
Yeah, that's great. So it was sleep hygiene,
Mm-hmm.
ideally by 10.
Yep.
Yeah, that's a big one for people. I know that was news to me that our organs are actually on a little cycle.
They are,
of their own. So we can support them with our sleep pattern. Yeah, beautiful. So my last and final question of you, Jewel, and then I'd love to open it up to others, what you guys are curious about. Similar to a lot of times we have people begin microdosing who are interested in the journey, but like we are in so many things, we tend to extremes, whether it's extreme diets or extreme fasts or extreme cleansing. And so in the realm of medicine work, microdosing is a nice, gentle, subtle way to apprentice yourself to the medicine, get in relationship. So can you take us through similarly when you're working with someone and in a functional medicine capacity and a whole person way, how you take somebody from the beginning and kind of work in that more systematic daily approach versus like the crash diet or the extreme changes or yeah.
Absolutely. So as I mentioned, I generally will request, and a lot of the clients that I see have chronic complex illness. So they're not easy, but I love trying to connect the dots, whether it's a lot of physical illness or whether, again, it's a combination of physical, emotional, and spiritual, which actually it all is. We just oftentimes don't see those other layers because they're not as visible to us. But I always request all your labs, your tests, your office visits, your notes from anybody and everybody. It could be your psychiatrist, it could be your massage therapist. I was just actually emailing a fellow that I work with back in Boston that does craniosacral and ileocecal valve work. And so I said, hey, Steve, send me the note on Selena and, so that we can be on the same page. And I want to hear what your updates are, with her. So I do a lot of collaborative work, and I feel like the only way we can help people heal is when we're all working together, and it's just not happening out there in healthcare in general. So I take responsibility to be the one that's going to be, I call it the PIA, but the nice pain in the ass to the physicians and the other healthcare providers say, hey, where's that note? Or let's have a chat on the phone or whatever it might be. So I assess all of that. I have detailed questionnaires, and that goes from birth till now. And what I'm looking for are, again, any physical challenges, but I'm also looking at environmental toxin exposure. I'm looking at traumas, early divorce, sexual abuse, any other kinds of things that might have happened along the way, when they might have happened. And that also helps to inform me about who I'm working with, stage of life, when things may have been imprinted. I don't know how many of you are familiar with the book, The Body Keeps Score, Bessel van der Kolk, but amazing book that talks about how our cells hold on to traumatic memories. And again, that could be a physical illness, it could be an emotional trauma. And so, those are things that I look at. And then we have our meeting, we sit down, and I create an initial plan. And we look at, what are the top areas that we need to be looking at here, from either a dietary perspective or an emotional perspective. A lot of the women that I'm working with are at that time in life when they say, I'm not even sure if I really want to even be in my job anymore. So we're going down the exploration of what brings you joy and passion. Do we need to course correct from what you started out in your 20s? I feel lucky that I've always loved my path. My path has been kind of convoluted, but it's been kind of along sort of the same path. And when I do my journeys, I will always ask, am I still doing the work that I'm meant to do? And I always get a very large yes. So I love working in that capacity. I use the Artist's Way from Julia Cameron oftentimes to kind of bring that work in terms of joy, passion, and all of that. So, and then I just listen intuitively to what I think might be going on with somebody. And we kind of create the plan. And then for people that want to work with me for longer term, there's a various number of ways for us to do that. Some people also, again, if they have more chronic complex things, may be interested in doing some of the genomic testing that I do. And I use a company called 3x4. What I like about their particular program is that after we look at where the genetic challenges lie, we look at a food-based, lifestyle-based way of addressing things first before getting into lots of supplements and lots of medications. And it can also inform us about other testing that can be done. So sometimes I will also recommend that particular program as well for people.
Beautiful. Thank you. I would love to open it up now to everybody. So I'm going to switch us back over to group view. Yeah, thank you. Thank you so much, Julie. I'd love to open it up to questions. Han, hey Hannah, hi. You want to go first?
Yeah, mine are quick. Hi, Julie.
Hi, Ann.
I'm not sure I understood the name of the marine collagen. So could you give me the brand name? Because I know I've seen it, but I want to make sure I can get that.
Yeah. So, and you're welcome to certainly reach out to me, and I can put you in touch with Emerson, which is the company that I use to get things. It's vital nutrients.
Vital nutrients. Okay.
And it's the wild caught. So I think that's a really important with any kind of marine collagen is you want to make sure that it's wild caught fish. It'll be lower in any kind of toxins.
Okay. And then the first one was thorn, and the basic, what it was called, basic nutrients.
Mm-hmm.
Okay. And broccoli sprouts, where do you buy the sprout if you want to do them yourself? Because they're pretty expensive where we go at Good Earth. And you can't always get them. So where do you get broccoli sprouts?
So, I generally get mine at Whole Foods, but okay. I'm sure if you go on and you look at, organic sprouting seeds, you can probably, and then they have these little containers where you can actually put the seeds, water them, and then cover them, and they'll grow, within about 3 to 5 days.
Okay, great. Okay. All right. I think that's the main thing I wanted to know. Thank you.
You're welcome.
Mm-hmm. Yeah, Karen, I saw your question. That's a great one. Yeah, no, go for it. That's a good one.
A physician recently told me that he believes everybody should only drink alkaline water. Could you talk about alkaline water?
Yeah, there's a lot. I actually had an alkaline machine in my home for a while, and there's a lot of research that goes back and forth in terms of pro, con, all of that. I personally am using reverse osmosis water. I feel that goes through a double process to kind of get out the things that we don't need. So I don't have a real hard set opinion on that, because I feel like I read things pro and con all the time about that.
Thank you.
You're welcome.
Well, so Joe, I know you had a question which I share about snacking. I share that question. Julie, do you have a sense of, I know from my reading with nutritionists, some people say it's got to be 3 meals a day. Some people say grazing is better. Some people are anti-grazing. So can you speak about snacking and food timing?
Sure. So again, I've been doing this long enough where we had people eating every 2 hours. And then what we realized is that when you're eating all the time, then you're actually constantly having your pancreas pump out insulin, and insulin is necessary for breaking down carbohydrates, but it's also one of the most highly inflammatory hormones in our body. So insulin is responsible for changes in terms of type 2 diabetes, as well as certain cancers and cardiovascular disease, arthritis and things like that. So the research now is really recommending that people try to go roughly every 4 hours. So I oftentimes am having people do more of a 4-hour move towards that. Folks who have hypoglycemia have to move slowly towards that. And again, we try to work that out. I think the most important thing is not snacking at night. And again, you know, for a lot of us, I used to love to have my snack at night, my cup of tea, my snack, watch a show, and gave up that behavior and trying to get that roughly 13 hours between dinner and breakfast the next morning can be really beneficial in terms of reducing inflammation.
Oh, cool. You said 13 hours?
Mm-hmm.
13 hours, ideally overnight. Okay. That's
Yeah.
super helpful. Yeah.
Yeah.
Karen,
Yeah.
did you have a question?
Yeah, I
Yeah.
did. I couldn't find you on Instagram because there are like 50 Julie Freemans.
It's my Julie Freeman Mindful Wellness.
Thank you. And,
You're welcome.
And also, do you want to talk at all about intermittent fasting?
So yeah, I mean, some people actually do really well with the 16-8. I would say that's a small subset of folks. And I oftentimes am recommending that 13-11 because that also seems to produce, you know, really positive results for people, and it fits into most people's lifestyles a little bit easier. But that whole idea of not eating late at night is really important for a wide variety of reasons. And one of them is that, again, as women go through menopause, oftentimes their cortisol levels are reversed. And so cortisol is our most important stress hormone. We're supposed to have higher levels in the morning that kind of gets us jazzed up and ready to go. And they're supposed to decline as the day goes along. But as women go through perimenopause and menopause, which is a physiological stressor, oftentimes they'll lower in the morning, which means we wake up tired, and they start to rise at night. And certainly snacking and eating at nighttime will increase that potential as well.
Thank you.
Thank you. Carmen?
Julie, thank you. My gosh, you've given us so many wonderful insights.
Oh, you're welcome.
Wow, powerhouse. Couple of questions for you. One is, could you talk a little bit about tapering off of SSRIs? We have a lot of people coming to us wanting to do that. And I know myself, that's what I did before I started microdosing. And I'd really love a functional medicine perspective on that.
Yes. So it's really important to work with your healthcare provider in terms of the tapering piece, to come up with a game plan of how you're going to slowly taper off your SSRIs. I had a patient, probably about 6 months ago, and I said to her, do not cold turkey your SSRI. Well, of course, the next time we met, she was a basket case, and she said, I came off my SSRI, and I said, so the gastrointestinal symptoms, as well as the mood changes and things like that. So that's an important one. Whoever prescribed it would be the person that you would want to legally speak with and say, listen, I'm going to be tapering off of this. Give me the tapering dose, or the tapering schedule. But that's an important one.
Thank you. Yeah.
You're welcome.
The second question, kind of along the lines of hormonal balances and menopause. Have you seen any kind of best practices for women and microdosing, or any observations you'd like to share with us? Because again, in our community, myself included, we have many people going through that stage of life, and microdosing has been a godsend, to say the least. But just again, any insights on best practices or just anything you'd like to share?
Yeah, so I feel like, there's a couple of different dosing schedules that are out there, and that's a good way to get started. And then what I do is I just intuitively check in with myself and say, does today feel like the day? No. Yes, whatever it might be. And I also, if I have something specific that's upcoming, and I feel like I really want to have a little bit more of that focus or that calmness, I know that on that day that I take it, I'm going to have a little bit of that edge, and that actually feels really good. So I kind of use a combination of the schedule along with my own intuitive feeling around things. So that's just my personal way of doing it.
Thank you.
Okay.
Yeah, love that. I recently spoke with a community of women who suffer from, it's called PMDD. It's 8% of women have, it's kind of the most extreme form of PMS.
Yes.
Where they are seriously debilitated. And they're almost like two different people. They're 2 weeks after their period versus the 2 weeks before their period. They're completely different. And so we were talking about how over time, it's nice to start with a consistent protocol of microdosing as you're getting the hang of it and connecting to the medicine. But once you get to the point where your relationship with the medicine is more intuitive and personal and individual to you, you can consider changing your dose depending on where you are in your cycle. Some women I think might benefit where you don't need, or you need much less of a microdose the first 2 weeks of your cycle, and you might need a higher dose and more days of the week in your 2 weeks prior. So that's just a completely new conception of a prescription. We think of the dose and prescription as always needing to be standard, but there's nothing standard about humans, and there's nothing standard about, our health and our healing. So I think over time, we're going to open up what our notion of protocol is and work with the individual in a functional medicine, total health capacity. And people will have kind of customized protocols for them based on nature.
I totally agree with that. And I've worked in mental health throughout most of my career, worked very closely with a psychiatrist who did a lot of research and work with women that had all kinds of different, PMDD, postpartum depression, things like that. She's also, written some books and whatnot. And again, a lot of times from an SSRI perspective, maybe the first half of the month they didn't take anything. And then the second half of the month, they were actually taking their dose. So I would agree with you, Casey, that I think that whole idea of, kind of playing with it a little bit and getting a sense of, how much do I need and what does that actually look like during a particular phase can be really beneficial. Yeah.
Yeah. Thank you. Does anybody else have questions? I have some more. So in terms of food joy, part of what we've noticed in the microdosing arc of healing is we go through these periods where we're feeling a lot. And at the same time, the medicine helps us, give us an assist to hold our emotions. They're more clear, but it can be a lot. It's very typical to go through feelings of whether it's grief or excessive fatigue, irritability and anger for some people. So can you talk about, because of the gut mind connection, are there certain foods or nutrient supplements that can assist us, like when we're feeling, more challenged emotionally, that we want to soothe ourselves with food and healthy sustenance versus kind of the less healthy food? So like in the moments that we would be normally reaching for carbs or sugar, what are those nutrients that we're actually looking for in those moments when we're feeling our kind of emotions up?
Yeah, it's a great question. So, and I just had this discussion with a woman who's going through a really hard perimenopausal phase with also a history of trauma and anxiety. And she's a trauma specialist. So it's, it's kind of interesting. It's like she knows this work for her clients, but then for herself, it's a whole other, it's a whole other ballgame. Part of what you want to think about is, am I hungry? Yes or no? If yes, what is the taste and the texture that I'm looking for? Because if we can satisfy a little bit around taste and texture, and it's really important to always have a carbohydrate with a little bit of protein. And the reason for that is that those carbohydrates are kind of like instantly here and gone. You're going to get about 15 minutes to no more than 2 hours worth of energy from an average carb, whereas a protein is going to extend that energy for about a 4 to 6 hour period. So that combination is really important. But am I looking for sweet, savory, salty, sour? And over time, we actually can learn to like some of those other healthier flavors, which are the bitter and the sour. Those are the things that actually keep us healthy, believe it or not. So part of it is, again, what am I yearning for at this time? And then also, if you're not hungry, a nice cup of herbal tea, something like throat coat, which has amazing mucilaginous, herbs in it, is great for the gut. I was just talking with another client today about fennel tea. Fennel tea is another one that's just really soothing to the gut. And if you need something a little bit more, upbeat, peppermint, ginger, things like that can also be really nice as well. But sitting with a nice cup of tea, rolled up in a nice comfy blanket and lighting a candle can also be a way if you're not really hungry, but then saying, but I want to go for something. So that can be helpful. Yeah.
Thank you. I loved your tip on wintergreen. I love the mint. Yeah, the mint family. That was great. Are there any other, again, I think underlying kind of our cravings and reaching external are emotional sometimes, and essential oils can be really, really powerful and soothing to our nervous system too. Do you have any favorite go-tos when it comes to essential oils?
Well, I love frankincense. Frankincense is, the highest elevation in terms of its healing qualities. So frankincense is something that I keep on hand all the time. I love the cleansing nature of orange, lemon, grapefruit. Those are great. I love the calming nature of cypress. I actually happen to be sensitive to lavender, so it's not a great one for me, but there's been a lot of clinical research on lavender being very soothing. So that's a great one for people. And then also just even doing like an Epsom salts foot bath with an essential oil can be so wonderful because we detox through our feet. And it's a great way to actually kind of relax. So, using some essential oils can be beneficial. Let's see, what else calming? Let's see.
I love those. It's funny that you mentioned
Yeah.
that. I have in my diffuser right now. I have frankincense and tangerine
Mm-hmm,
today for those same reasons. Yeah.
Yeah, cedarwood, vetiver, those are also really, really good for anxiety and relaxation. And actually even putting them on the occiput, the little bony areas of the back of the head can be helpful because it gets pulled right up into the brain. And so I love cedarwood and I love vetiver for those reasons as well. Palo Santo. Oh, I have an amazing cream. It's called Palo Santo Body Butter from one of the companies that I work with, Anne Marie Gianni, and I absolutely love that stuff. So, and you can really smell that Palo Santo, which is great. So,
Wonderful. Another question I had about movement and exercise. I loved what you said about over exercising, because I think as much as under exercising is common, over exercising is too, or people feel like they have to do certain things. A big one is we get a lot in our microdosing community. They're like sheepishly like, I don't like to meditate. I know I'm supposed to. I know it's part of the deal, but it's not my thing. There's so many other things we can do. So can you speak to movement and exercise and how it ties into and how we can adapt it to our own nature?
So I do so for the higher intensity exercise, it's also going to help with building muscle and making sure that our structure and function is working well. I do like the HIIT principles, the high intensity interval training, because that's a short period, 20 to 40 minutes. I teach people about their target heart range. I have maintained my yoga certifications and whatnot, so I always keep up with personal training certified stuff as well. But I think, knowing your target heart range and staying within it and working within it is a really important thing to know. If we're trying to get more of a parasympathetic or relaxation response, then I have people look at, yoga nidra and restorative yoga and things like that, or in Tai Chi, just even some of those flowy movements are just wonderful in terms of like working with your energy fields. This week I've actually been playing with my energy field. I was talking with a friend yesterday, if I told anybody this, they think I'm nuts, but at least you're in this world with me. So.
Not here.
Yeah. So that whole idea of kind of playing with your own energy field and helping to, bring your battery up or relax your battery is important. And actually something that I use with a lot of clients is to say, what charges your battery and what drains your battery? And look at whatever those behaviors are, those relationships are, all that kind of stuff. So I think that that's important. So a combination of exercise is important. As we get older, man, do we need to have balanced exercise? Because again, the changes that take place in the brain as estrogen declines, we do get a little bit more rigid. And this is another one of those areas where microdosing can help with neuroplasticity and flexibility, adaptability to change and all of that. So again, I think that's a really important one to, include balance in there as well.
That's beautiful advice. And I've always been so curious, like why people, as we age, do we get more rigid instead of more open? You know, why is that necessarily the case? But that's really interesting to know that it might be hormonally impacted.
Hormonally and also and also genetics. And it's interesting when I did my, I've been working with genetics for probably close to 10 years. I've used about 7 different companies over the years and tested out what I liked and what I didn't like. And like I said, I really like 3X4. It's more user friendly and digestible, no pun intended, in terms of understanding, kind of dense information, scientific information. But looking at our brain chemistries, and I was really surprised. I always have joked and said I took after my mom. She had every autoimmune thing that came down the pike, and I was like, yep, I kind of follow like mom. But on my dad's side, there's dementia. My Nana had really serious dementia. My dad had dementia. My aunt has dementia. And I said, I'm pretty sharp as a tack. When I got my genes back, I saw that I actually have a lot of those brain ones as well. So that actually informed me in terms of supplements and diet and things like that I need to pay attention to because the potential is there. So just because you have a genetic predisposition doesn't mean that you're going to want to get it, but it means like, oh, all right, you know what? Here's a roadmap and I can influence that in a positive way. So kind of a long answer to your question about exercise, but
love it. Yeah, no, that all resonates beautifully. Yeah. Anybody else? I have one more question then to wrap up. Jill, I'd love to get your personal, in terms of integration, with your medicine practice and kind of bringing all the things together. What are some of your favorite practices for integration? And they can be physically, mentally, spiritually. Yeah.
So if I look at from start till finish, the way that I work with women who are interested in using microdosing is to, again, start with that assessment, but also start with that whole intention setting. Why am I doing this? What is it that I would like to get out of this for me and for the collective at large? Because I'm always looking at, I'm one person, but I'm also influencing the rest of society and the rest of the world. And then to journal and kind of keep tabs on your process as you're going. And so I spend a lot of time with some of my clients on that. We may not even talk about nuts and berries in our visit, and it may really be more about what's going on in their process. And I think that journaling, getting time out in nature, I think those are really important things for people to do in terms of their integration and to really take some quiet time in order to do that, to really kind of sit with yourself.
Thank you so much for being with us. Yeah. I warned everybody that Julie has so much knowledge across so many, we could talk on and on and on for hours. So thank you so much for being with all of us today. We really
you are so welcome. Yes, it was a pleasure.
I encourage you all to follow Julie. She has a very tasty, delicious feed on social media. And it's juliefreeman.net.
juliefreeman.net. And I just updated my website on Sunday. So there's much more of a focus on women's health and on bringing, microdosing education into the discussion. So
beautiful.
Great.
Yeah. Thank you for your work. And thank you too for your work in bridging. You're one of those people that is really a bridge between kind of the Western model, and you can speak that language and the models that we are in the process of creating and co-creating. So thank you for being one of those people. Yeah.
Thank you so much. Yes.
Yeah.
Okay.
Cool.
All right, everyone. Well, have a wonderful day. If you have any questions that come up after the fact, please feel free to reach out to me. I'm very email friendly. It's julie@juliefreeman.net. Happy to answer any questions that might come up after the fact. So thanks again. And thank you again, Casey, for all the wonderful work that you do.
My pleasure. Thank you.
Okay.